Well, I think it's a hard question, right? And I don't think it tastes different. Thank you for having me. I would like to start with community health workers. Community health workers, I don't know how many are we here, but we are trusted, knowledgeable members who typically come from the community that we serve. We bridge that kind of linguistic barriers with our communities. How we do this? Well, bridge trust with our communities is so important. We listen to our communities, but with respect. We share opinions, and we value what they think. Health education is a great need in our communities. I promote health wellness by providing culturally appropriate health education to our communities in the way that they can understand, not with the jargon or with the confusing medical terminology. In that graphic, you can see the non-Hispanic community have a significantly higher rate for colonoscopy, 72% versus 57% with the Latino community. And we have barriers and risk factors. And when we talk about this, colorectal cancer is the second most common cancer diagnosed in males and in females in the Latino community. And unfortunately, is more likely to have advanced stage cancer or a large tumor when this is detected. Even though we have a lot of barriers, we have strength. We have relationships that we can make with our communities. Building trust is very important. We don't bring a kitty to the classes that I do, but it helps. It helps because there are a lot of misconceptions if the colonoscopy is only for females or if it's only for males. When I go there, I'm sorry, but it's for both, and we have to do it. This is the medicine, the laxative that we use at the hospital for our patients, and then this is something that we have materials, bilingual materials, and also I want to say thank you to the American Cancer Society for the support. And this is our flyer that we post this flyer all over, local stores, churches, schools, community centers, and it's about the criteria that our patients need to have for the free colonoscopies. This is our slogan. In the Latino community, sometimes we tend to say, mañana, tomorrow, and then because waiting until tomorrow can affect your health, forget tomorrow and let's just do it today. Then this is how we encourage to our communities. And I'm right there at the church in Richfield doing a health education presentation, but it's just like sharing that information about what is colorectal cancer, symptoms, signs, diagnosis, different screenings that are available. I'm right there at Centro Chicano Latino that is in Minneapolis. Pretty much we go everywhere. Making connection is so important to have this job done because it's not easy to go with the communities if you are not building trust and say, oh, do you want to have a colonoscopy? It doesn't go well. Then it takes time, and building trust is so important. Being with our communities, sharing information with them, and also taking the time to explain what is a colonoscopy. Univision, a local channel that is in Minneapolis, then there are different ways to do outreach in person or through the TV. Also, we've been doing programs through the radio, La Raza station, and then something that is very important is to bring patients to those programs. Testimonies are so important for other people because they encourage other community members to have this colonoscopy screening. I'm right there with Eden Prairie, but pretty much what I do since the beginning is building trust is the first step. Education, we do education, I do the education, enroll patients. I help to the community health department and the GI and oncology department to schedule patients, and I meet with the patients one by one to explain the procedure. I'm at the Incarnation Church in Minneapolis right there. Some of the awards you might recognize, Mr. Kay Ellison right there, but we have recognized by the American Cancer Society for the work that Fairview has been doing. The most important award is when the patients say, thank you for sharing this information to us. I'm a true believer that the key to have better outcomes with our community is working together. Let's just keep working together as a community and we will have better outcomes in the health system. Thank you very much.